Hello everyone, this is Dan Pawlus, Senior Customer Marketing Manager at HealthStream, and we're here in the HealthStream headquarters. I recently had an opportunity to sit down with Kelly Aldrich, the Director of Innovation and Associate Professor of Informatics at Vanderbilt University, and we were able to talk about interoperability. She has some fascinating insights to share. We're a healthcare technology company, obviously. There's lots of technology, again, out there. In a short blurb, I guess, tell me, what do you think we need to be working on, big tech or whatever we want to call it, to make an impact for the nurse and for ultimately for the patient, right?
Here's what I would tell you. I would work on teaching your tech folks to go into a hospital and follow nurses around.
Love it. So on-site observation
Actually
of
see,
usage
because
of
one
the technology.
hospital is not the same as another hospital, nor within a hospital is one unit, like a cancer unit, an oncology unit, is not the same as an emergency department. And we just go, here you go, make it work.
Yeah.
And so then we wonder, why are these nurses doing workarounds? Workarounds to me are never events. If you hand me a piece of technology where I am taking care of a patient or is in a care environment, and if I have to create my own, we're really good at workarounds too. That's a never event. Those should be sentinel events because something's wrong with the process. The people are having to work around the process to use the technology. That's where you lack high reliability. That's where you introduce risk of the variation of care, and that's where failure occurs. That's when harm comes to patients.
And I love what you're saying. Maybe I'm going to put words in your mouth here, but it sounds like we need to humanize the way that we approach the technology, right? To hand it off. It's a tool, but it is just a tool that we need to understand how the nurses are actually using it and train them accordingly and make the UX and everything that it needs to be the most efficient for the ultimate result.
100%. And here's the other thing I would say. When I created something called Vitals Now, I was working on my doctoral work, and I wanted to automate vital signs at the bedside. Followed a bunch of nurses around, right? Got the workflow down. Nurses were maybe writing it on a clipboard, writing it on an INO. They were writing it everywhere. Why were we writing any of this down? No idea. And so, but when we finally got down to working with a partner, with a tech company partner, they were very, very frustrated with me because I kept halting the implementation because it wasn't working the way we needed it to. So we learned and we had to adapt it, fix the tech just in time to meet the workflows of what we were rolling out. Ultimately, where we landed was it was introduced in over 900 nursing units, and that was about 15 years ago, and it's still the #1 requested technology today in the company. And I attribute that to, we listened to the nurses. We didn't just give them a piece of technology how we thought it should work, how the tech company thought it should work, but we actually worked with the clinicians who were using it and then evolved it to meet their needs. So I guess my message is there is no piece of technology in the clinical environment that should be considered a final product.
Yeah, I think here at HealthStream, we really try to listen to that and approach our whole process that way, right? We've got to produce a beta, and then put it out there and partner and get some results, some real results from the partners that are using it, and tweak it accordingly. Because again, we're trying to improve the quality of healthcare, by developing these people that are delivering the care, right? So we want to get that feedback and get it right, and the more partners that are willing to do that to help us get those real answers are important.
Really, really important. And bringing in human factor specialists or informaticians would also be beneficial. That a lot of companies maybe either overlook that, but that's really the ease of use piece. So if you picture around a critical care bed or an emergency department, an operating room suite, think of all of those machines, right? Like I said, there's usually about 13 of them. Now, if you in your personal life had a phone for every app that you had, and you had to manage every single phone because they were separate phones to do something for yourself, that's what we're talking about. So how do you think that you're going to get that right for all of the workflow areas, right? So I think my message would be is the acceptance of the optimization to make sure that we're actually meeting the clinician's needs, because ultimately it benefits the tech company too, whoever it is, because now you have an even better product.
Yeah, better product, better utilization, better outcomes, all that.
Right.
So